I'm the principal of the London College of Clinical Hypnosis in Asia. Hypnosis is very different from the swinging watch and the you're in my control. It isn't. Actually, what hypnosis is a state of relaxation where your body is relaxed, your brain is thinking nice relaxing things, we talk in a nice relaxing voice. In that state, we also find that there's a narrowed focus of attention, so the person is able to focus on the problem they want. I was looking for a medium that enabled me to work with patients and didn't just focus on the patient's problem, but actually allowed them to focus into strategies for solutions. You know, if you work with children and you bring compassion to the table and you give good structure, children can make changes very easily. But adult patients are not the same. Adult patients have bought into the problem. They want to understand the problem, they want to talk about the problem. It's almost as if they don't have a world outside the problem. And what hypnosis does is it allows you to take the patient into a relaxed state, release the hold that they have on the problem, and they can then, just like children, make the change simply and easily and efficiently. It's fantastic. We can use aspects of hypnosis when we're working in many different conditions. We can use them when we're working with psychological problems, emotional problems in HR, and also for motivation, for habit change. And it's so powerful. We now know that if we trigger the relaxation response, we can actually switch off genetic markers that trigger harmful illness. That's a big deal. But for students specifically, many students today get very stressed up because there is so much pressure on students. And what hypnosis can do is it can help students, patients, people to put down that stress response. And when you do that, not only does the immune system strengthen, but your mind is clearer. So you're processing information, you're making connections more easily, and you're also applying it much more efficiently. So for the student, not only does it kind of give them a little peek into what clinical hypnosis is about, but what it also does is it gives a skill that after the talk they'll be able to use for themselves, which will help them for their exams or for job interviews or in life in general. Psychology students are going to work with so many different groups of people who need help. It'll give them another tool, and I think that's really important. The most important skill that you're going to bring into your consulting room is going to be your rapport and your interest in your patients. Nobody's going to sit there and close their eyes and go into a relaxed state if they don't like you and you're not interested in them. Whether you're going to be working in a workplace or whether you're going to be working in private practice or even in hospital, you learn some of those skills. Not only will you learn them because we're going to talk about them, but you'll experience them yourself. And it's a funny thing. Hypnosis is a natural state. We can all enter hypnosis, and we do. But as you do that, you will connect to some of your body's own natural mechanisms of healing. And when you learn that, you'll know quite instinctively how to facilitate that and bring that about in your own client groups, your own patient groups, and even if you go into industry, those poor stressed out executives who are going to come to you for support. No, we can't do chicken dances, get your money out of your ATM or even get your PIN number. We can't do that. And if we could, we would already have gone to see our bank manager, put them in deep trance. We'd have wonderful loans, no interest. You'd never see us. It's not possible.